Raspendika Amulano Amulano Raspendika Amulano Amulano Edukatif dan inspiratif Raspendika Amulano.
Assalamualaikum warahmatullahi wabarakatuh. Good morning Rakan Murno. We come back again on our podcast under the title of Speak ya, seputar perbincangan edukasi Aceh kita. In this special session, we have 3 resource person that we shall learn from. And this special session, we shall talk about great thing regarding adolescent and health, especially for youth and adolescent from Indonesia, globally Indonesia, Aceh, and especially in Banda Aceh. So, as we know that, Rakan Murno, youth and adolescent in Aceh shape more than 20%, and youth and adolescent is also challenged by so many health issues, and as people that care about the youth and adolescent, we shall discuss what effort that we already conducted and shall conducted in order to increase the health of youth and adolescent. So therefore, my name is Imam Maulana as the host today, and here we already have 3 resource person. The first one, we have Mr. Martunis. Good morning, Mr. Martunis.
Good morning. Assalamualaikum.
Waalaikumsalam. How are you today?
Good. Alhamdulillah.
Alhamdulillah. Pleasure to have you here. Mr. Martunis is the head of Aceh Provincial Education Service. And also we have special guest from UNICEF Indonesia, Mr. Brunal Sete.
Morning.
Morning.
Selamat pagi.
Are you okay?
All well, thank you.
Very nice in Indonesia.
Enjoying myself.
Is this your first time in Aceh?
It is.
Thank you. Pleasure to have you here. And also we have special guests from youth. Here we have Celia Cinta.
Hello,
right?
good morning.
Good morning, Celia Cinta. Celia, you're from senior high school, right?
Yeah, that is right. I am from senior high school,
Senior high
especially SMA 3 Kota Banda Aceh.
SMA 3. Which grade are you?
I am in the 2nd grade.
And the second grade. Pleasure to have you here. So, ladies and gentlemen, our resource persons come from people that are already doing a lot of effort regarding youth and adolescent in education and also in health itself. So, let's start our discussion. Okay. So, the first question, we would like to know about what is the health challenges faced by the youth and adolescent in globally Indonesia, especially in Aceh. Maybe Mr. Brunal can answer this first, Mr. Brunal.
Thank you, Iman. I think it's a very important question. But to contextualize the conversation, let us first understand the numbers.
The numbers, right.
So if you look at the Indonesian data, you will see that 46 million of the 270 odd million population is in the adolescent health age group. So it's a huge population, right? And this is the population which is going to be the future of Indonesia. For Indonesia to get to its 2045 golden vision goal, ensuring that we achieve that mission, it is this population which will bring Indonesia there. So it's a very important population. It's a very big population, right? Both from a health as well as from an economic perspective. Coming down to Aceh, Aceh contributes almost 1 million to this 46 million people. So that's not small. And therefore, Aceh has a key and important role and stake in this economic process. The good news. Now a little bit of the bad news. Almost 10% of this population lives below the poverty line. And why do I mention this? Because any population which lives in poverty has vulnerabilities, has different exposures, and therefore more health crises and other psychosocial needs, right? And when they are adolescents, it just gets compounded, right? So in that context, let us just look at some data sources on what are the major problems that these populations are facing. If you look at the global data, there's a global database called IHME. It lists road traffic injuries and drowning as one of the top 5 causes of death of children between the age of 5 to 14. In Indonesia, this is true and is very closely followed by tuberculosis. Almost 140,000 children under the age of 14 are currently suffering from tuberculosis. This is 2023 data, right? So it's a huge problem. And below that is the whole array of issues in the space of mental health. Maybe a subset of mental health, maybe a separate issue by itself, is the dependence on tobacco or tobacco related products, including vaping. The data is quite disturbing, and I'm just going to quote some data points. The national adolescent smoking rate has increased from 7% to 9%. And this is older data, so I'm assuming that this has even increased further. And this is compounded by the entire industry, which is glorifying vaping and other sort of substance abuses, right? And the adolescent group is also a mentally very vulnerable group, especially in the context of what's happening on the social media now, the peer pressure, and therefore tobacco consumption, vaping, smoking is an ever increasing problem. It is surprising to see that the onset of smoking is quite early, and the children are actually consuming almost 12 to 14 cigarettes a day, and they're spending and they are spending around 20,000 Indonesian rupiah per day. So lot of children smoking early, smoking a lot, also has its economic immediate outcomes, plus also long-term impact on health. So at a very high level, these are the issues that most of the adolescent children in Aceh and in general in Indonesia are currently facing. I hope that helps answer the question.
Yeah, thank you. It's really picturized the health condition in especially for health and youth globally until also in Aceh. So there's a up-to-date data. So you are talking about especially from tuberculosis and also the impact of social media regarding the vaping, smoking cigarette, and also the mental health issue. Nowadays, smartphone is even the children in elementary school are already using smartphones. So I really agree with you that social media has a big impact regarding youth and adolescent. So just some question for Mr. Martinez. What do you think about the health challenges faced by the youth and adolescent?
Yeah, I agree with Dr. Murnal that if we hear the data on the adolescent health, and that shows that 1 million of adolescents are in Aceh, it means that it's 20% of the populations, and the problems is I think it's worth to take into considerations. And we may very know that the objective of education is to transform our students. Of course, my mandate is the secondary and upper secondary students, and is to make them have a good characters and also have a competences. Health is the basic necessary to achieve that. So, and we know that social media and the demography expert says that our students is Gen Z students, that is strawberry students.
Strawberry students.
They seems like a good in physical appearance, but very probably soft or vulnerable insides. And our concern is we have to make the students strong physically or mentally. So that's why we very eager to cooperate with UNICEF and also with the communities, and how we can strengthen the health of the students, both mentally and physically, and also environmentally. And unfortunately, we have a healthy school movement that is also one of our priorities, to make our schools as much as they can be healthy schools. And that's why I think we need more collaboration between many NGOs, international donors, and also from students, and also from the school management. And I do concern on the data of Dr. Brunel said before, and social media plays very important roles. And social media is the communication channel that used extensively by students. We have to gain that. We have to be able to control social media, to campaigns, the messages, to make our students more healthy, both physically and mentally. If we do not, bad industry will take care. We will control our students, and that is not good for our generations.
That's true. So there's an approach regarding to create the environment in school that more adolescent friendly and also care about the
Right.
health itself.
Right.
So that's
Right.
very interesting. Okay, thank you. Let's hear from our youth perspective. Same question, Sally. What do you think regarding the health problem faced by the adolescents?
Okay, so about health problem being faced or being a challenge for adolescents and youth in this generation. So we all know that I agree with Mr. Martinez and also Dr. Bruno about the expanding of technologies in today's era has making adolescents and also youths being exposed to technologies such as like smartphones. They are being exposed to many social media trends, which makes them have the term of FOMO or fear of missing out, where they tend to have the tendencies to actually follow this kind of trends. And that is why with the environment having a big impact towards these children's and also teenagers' mind, they will eventually try to follow the smoking, the cigarettes, and also the vaping system and also the trends. So they are just trying to keep up with the globalizations from seeing how this kind of people trying to look cool by trying to vape, when in this case actually smoking and also vaping gains really many bad impacts. It's like lung disease, respiratory illnesses, and especially the most dangerous part is that children and also teenagers could gain an addiction towards nicotine, which is very dangerous. And then as we all know, in addition to also smoking, there is actually air pollution issues also, where it is being stated by a database that in 2021, more than 8.1 million of deaths towards children and also adolescents are being caused by this air pollution because it may cancer, lung disease, and also other illnesses. And then next up, from air pollution, we are going to be jumping into mental health issues, like Dr. Bruno has stated that today's adolescents, based on the database, it is actually 4% of adolescents in Aceh today's, they will eventually get abnormal mental health situations because of many various events, such as bullying perhaps, cyberbullying from the social media, and also the studying pressure or pressures from the community and societies, and that's why they gain many mental health issues such as like depression. And then this depression can actually lead into many dangerous things, and eventually it can just make them attempting suicide also. And I think that is very saddening. That is why mental health issues, cigarettes, and then also air pollution are three main things that our adolescents and children being faced towards health issues these days.
Yeah, that's very interesting perspective from our youth friends here. So, from the youth community, also realize that we have challenges regarding so many things, not only physical vulnerability but also the mental vulnerability. Therefore, multiple approach regarding to create the safe environment in school especially is very important. So come to the next question, Mr. Bruno, regarding the adolescents need to receive or access to friendly health services in Indonesia, in Aceh. What do you mind to share about the challenges regarding how adolescents get or receive the services in Indonesia, in Aceh?
I think it's a very important question again on what is the right service package and how do
Yeah.
they receive the services. But I think I would like to acknowledge one fact with my my adolescent colleague in this forum. It is not easy to be a adolescent today, right? Probably my generation had it much easier. When I needed to do something, I had to climb down the stairs, walk on the road, knock on a door, shout out, call my friend.
Yeah,
Right?
that's true.
It was a process. And then if I wanted to gather a group, I had to do that
Yes.
10 times over, right?
Yeah, that's true.
We didn't have WhatsApp, we didn't have groups. So, right? So, with this also convenience that we see today, as my colleague mentioned, uh, the whole onslaught of the digital world has created an alternate world, right? An alternate world where everything is rosy, where everybody is happy, and where everything is perfect, right? And with the impressionable minds of the vulnerable youth, it's very easy to steer them away into this realm of fantasy, right? Away from reality. The reality is life is full of challenges. There are rocks on the road. You will stumble. You have to pick yourself up and walk along. And no one in this world has had the perfect life without a single issue or a single problem. But because of the digitalization of these relationships, you see only the glory. You do not see the failures, right? And that creates a false situation, a false narrative in which you do not have the resilience left as a youth to look at a failure, accept it, rise up and go. And I think that is the bedrock of any intervention that we plan or we want to do, whether through the government systems, through partners like UNICEF, or through the youth movement that we currently have. I think we need to send out messages. It is okay not to be okay.
It's just again to be okay. That's good one.
Yeah. I think it's okay and it's perfectly fine that you're not doing well today. And there is no shame in it. And that we need to make people aware, number one, that it's okay not to be okay, and create structures in place by which when they are not okay, they can seek help. And seeking help is okay. Right? We need to move away from this concept that mental health is something bad, or it means that, oh my God, the old notions of major psychiatric illnesses and the stigma attached.
Stigma.
I think we are way past that, especially in such a digital world where you have so much information, right? So that's the good part of the whole digital revolution. You have information, good information as well as bad. So yeah, the system needs to be there for us to be caring and available for those who need us at the times of need. And it starts from basic work that the government is doing, like the healthy school movement. It creates an ecosystem for building more resilient and physically and mentally stronger generation, right? Then you have the government of Indonesia's Ministry of Health and its system, which has the adolescent health programs, where you have screening programs, where you have counselors in places for anyone who feels and has a need of approaching, can access them. All of these are also covered under the BPJS or insurance scheme, so it is not a big expense on the pockets. And things are becoming better and better, right? Science is evolving, more resources are available. The first step that one needs to take with all of this infrastructure in place, both enabling environment as well as where you have resources for care, is the ability of the youth to take the first step to raise the hand to say, I need help. If you create that environment, things will start falling in place. And one constantly needs to ask oneself, why are our youth not doing that enough? Right? And for this, we have some disturbing data. On an average, 2% of all Indonesian youth seem to be having anxiety or some other form of mental health issues. Of this 2%, 60% have ideated in the last 1 month on committing of suicide. So that's quite serious. They have thought about it. They have not committed it. But the distance between thinking and action depends on the severity, depends on the loneliness, depends on the environment that they are in. It can become something horrendous very quickly, right? But this is important data. But more worrying is that only 10% of these kids are seeking help. So I think we, as implementers, as policymakers, as the community, need to do a lot more. We are doing a lot, but we need to do a lot more to create a safe environment for these children to not hesitate to want and ask for seek help. Remove the barriers which are preventing them to seek help. Right? So that is my thought on this.
Yeah. So not only we are strengthening the services, but also we need to spread the awareness that it's not shameful anymore to say that I'm not okay and look for help. So it's very interesting. It's like we want to build places, but we need to make sure people want to go to the places, right? It's very interesting. So also the same question for Celia. Um, Regarding the accessibility for the health services, for the friendly health services for youth, do you have any opinion on that?
Okay, so I really agree with what Dr. Munil has said, because children and adolescents are proved to be someone who is actually very vulnerable, and they have the tendencies to actually easily get influenced by something. With the expansion of technologies and social media, information is getting more widely ranged, where they could actually access this information easily, and will tend to sometimes misunderstand what it's actually meaning, and because they have seen the social media as something oh so colorful, so full of rainbows, they tend to see their own failures, their own mistake as something that is unacceptable. And that is why they have grown anxiety, the depressions, to actually keep up with the grown-ups and trying to keep up with all their friends who is trying to get another achievement. That is why with this, they tend to have the tendency to actually feel like, oh, I have to do better. Feeling sad is nothing. Feeling sad is actually unacceptable, and this is why a problem, because these adolescents grow into someone who can actually speak about their own feelings, and that is why I think the informations, this kind of social media, to actually spread awareness towards these adolescents and also children, because feeling bad is actually okay. All of your emotion is all valid. You can actually seek for help. You can even reach out to your close friends, to your family, or someone that you trust a lot, saying that I don't feel okay, because at the end of the day, you have more time to improve yourself on. You have more time to learn for yourself, and of course, you will grow into someone who will be better, because not every human is perfect. You can learn more. That is why ending your life is something that is you should not do. And I think because of that, the challenges for these adolescents and also youths to exceed on and also receive the health care system is that we actually have to spread more awareness that this mental health issues, the smoking problems, and also the air pollution problems is actually a serious problem that we are currently facing.
That's very interesting. And Rakan Murno, this is something interesting regarding our youth here. Celia, if I'm not mistaken, you and your team create an innovation, right, regarding...
Yes, that is correct.
Can you explain it for us?
Okay, so for the innovations, me as one of the team in Youth for Health Impact program, from the group of soul bonding. We are from the mental health section, and here we are trying to make a boarding game, including words with the method of coaching, where these adolescents and also youths can actually tell stories from just expanding one word. So this card contains one word where they can actually speak about the words, like for example, you got a card saying brave, and then the mentor of the game will say that, have you ever feeling brave? What makes you brave in this situation? And unconsciously, these adolescents, these youths actually speak about their feelings. And at the end of the game, we will tell them that, see, you can actually tell a story. Telling a story is actually very fun. And see, people can actually listen to your stories. And that is why I want to say that if you have some bottle of feelings, just know that there is someone who wants to hear you out, and you can actually seek help when you need professional help. That is why I think this innovation are very great things, because we have tested it in 2 schools in Banda Aceh actually, and I can see that they were having fun while playing the game. Adolescents and youths actually having the determination to actually tell what their stories, their experience are, and I can see their happy face, and that was what makes me very happy, because I can see my adolescents and youth friends being happily.
That's very interesting because regarding it's okay not to be okay, in the end it's about trust. The trust you get from the children, from the adolescent to other people, right? So very interesting that back in the day before we have smartphone, we at least when we want to play with our friends, at least we call their name at their house, in front of their house, and not all the time our friends going out and answer our call, but most of the time their parents. So the children have interaction not only from their friend but also their parents, and it makes them more trustable. So they are trying to communicate with more people, not only from their amongst their peer group, but also from adult people. So this is what Mr. Murnal said. Nowadays, when you go to your friend's house, we just pick up the phone. I'm in front of your house too. So how many people, how many children know the parents of their friends, right? So interestingly, the services, most of the adolescents, especially in junior or senior high school, spend half of their time in the day in schools. So we heard that there is a concept, an approach in school, like if I'm not mistaken, the name is school movement. You told us before. Do you mind to explain it for us?
Yeah, I emphasize the safe environment,
Safe
environment, and also trust. As you mentioned, I think safe environment is something that we have to provide for our students. If the environment is safe, students tend to trust each other. If they are perceived that in schools we are safe to feel sad, we are safe to do innovations, we are safe to do something different from others. So the trust will be built. And of course, I myself think that the school must be a sanctuary where students can do anything they like. Students have their tendency, their preferences, and that must be respected by teachers, by principals, by school masters, and of course this is the ideal goals. But challenges remains. That is what we call that is students come from it's not broken homes families, and or so that is teachers that is not very that doesn't understand how to challenges faced by adolescents. So we need to do many things to make the ecosystem safe, and then the students will feel they live their life very happily. They can do anything, and it is interesting for me what Dr. Mona said, that we have to prepare our students to lives are full of failures, are full of success. So our students must prepare if they are success, and also if they fail. If they success, they should be calm, okay. But if they fail, they should not be disappointing and do something bad. So the Dinas Pendidikan, our office, is very eager to make the safe environment in school. We have to make sanctuary of school, building characters, providing them competencies, and we do hope that the students will bring out this optimism, the new behaviors to the environment of schools, and then they will make their parents realize and other friends. So by making school as a safe environment, I think this will make our final goals by making our students competent and character will be good. Healthy school movement is one of initiative, a very good initiative that we have to make it successful, and that's why I think we need collaborations, and also I encourage Celia should be a model for our students. We have to create more Celias in our schools, because teenagers now, adolescents now, they will react with trust. So if we cannot behave like Gen Z like behaviors, I think it is hard to convince the adolescents to do or to prepare for their future. So our policy must consider the Gen Z approach, the Gen Z preferences, the youth preferences, so that the policy will be better implemented.
Yeah, that's a really
Or
nice
something.
approach ya regarding the safe school ya, or gerakan sekolah sehat.
Yeah, safe,
Gerakan.
it's part of safe environment to
So as we know that we believe that the teacher is the second parents, right? So not only they teach us, but also the children or the student need to trust their teacher. Also, maybe not all the teacher, because children or students tend to have their own special teacher. At least if each student have at least one of teacher that they believe in, so not only they will learn about the science knowledge, social knowledge, but also when they have problem, they can speak up.
Yeah.
They know they don't need to go to the puskesmas, but they can talk with their teacher, look for help in their first environment, and then if the teacher see need to go to the professional, we can bring it if you want it, right? So it's a really nice concept. We hope that the gerakan sekolah sehat can be implemented and can achieve the goals. So I think this is the first session. Let's take a break and we shall talk about something more interesting in the second session. Thank you. Let's.
Thank you.
Ras Pendika Amulano Amulano Ras Pendika Amulano Amulano Edukatif dan inspiratif Ras Pendika Amulano.
Rakan Murno, we already discussed so many things regarding the adolescent health challenges. So in this second session, we would like to talk more regarding the mental health issue in adolescent. We already believe that our student, especially student, need help for make sure they can overcome if they have mental health issue, right? So, Pak Martunis, in your opinion, how can the student, teacher, and also parent help the adolescent overcome this mental health issue?
Yeah, first of all, they have to be supportive. And to be supportive, they have to have knowledge on the mental health issues. That's why I think first thing first is we have to socialize. We have to make them aware of the with mental issues problems, because the problems is rising now and it is quite challenging. It's quite serious. So in terms of schools, I think we need to make sure that the teachers, and there is a teachers, we call it bimbingan counseling teachers, the counselors, and this is also must we have to revitalize that, because some mindsets is not very good in schools. The counselors nowadays they just deal with the students with problems. They should also be able to identify the potential mental health, and this should be they have to be given more roles on that, so they can anticipate, then they only cure the problems. And in terms of parents, I think we have to make them more. And I think that the most important is we have to make a youth community in schools. So the school with the mental problems does not feel alone. They have friends to share and seek help from peers. And I think there are three things: parents, teachers, and also friends, students. We have to strengthen this in the schools to overcome, to make the students away from the mental problems.
Nice. So we need to revitalize the teacher, not only be able to deal with problematic student, but also to detect before the student become problematic itself. So that's really nice regarding the role of the teacher, and also the youth movement from the student, and also the role of the parents. Same question from our youth perspective. In your opinion, what is the role, or how come the student, teacher, and also the parents play a role in overcoming the mental health issue?
Okay, to overcome health issues itself, especially mental health issues, because we are talking about our internal feelings here, both the actors, the parents, the teachers, and also the students or the peers, the youths in schools actually plays a big role in maintaining or overcoming these mental health issues. So first of all, like Mr. Martinez has said, the teachers, like counselors, office teachers, are not someone who deals with quote unquote the gangsters of the school. They're actually dealing or trying to counsel these children or youths to actually do better things, and actually trying to find out the main roots of why are they causing these problems, because we actually don't know what happens to the adolescents and also the students they have faced in their own home probably, or in their own community or societies. And that is why I think the teachers plays a big role as a second parent in school to actually detect the problems in adolescence itself. And then parents having the role of trying to determine what actually problems does their child have. Like, especially in Banda Aceh, we can see that most parents still stick to the traditional way of not actually getting their children to therapists or therapy when they actually need it, like someone who has depressions, someone who has anxiety problem or anxiety syndromes. They actually need professional help to help them sleep, help them concentrate in school, and also help them bonding with their friends at school. That is why I think the parents needs to see the awareness of mental health issues does plays a big impact towards adolescents. And for the adolescents itself, I really agree with how Mr. Martinez said that adolescents, how to approach them is by having another adolescent telling them what to actually do. So that is why a community of youth in school having the counseling peers, especially when they can actually feel very comfortable to tell stories about sad, angry stories, or something that makes them really happy, and that is why they can be mostly comfortable and will eventually see that someone is actually listening to them. And by these three factors, I think we will eventually come mental health issues regarding adolescents and also youths.
That's very nice. That's very nice opinion of you. So we are trying to prevent before we cure others, right? So to make sure mental health issue can be overcome or prevent, we need the approach from the student itself, and also the teacher, and also the parents. That's very nice. Regarding mental health issue, this month, especially in 10th of October, there is a World Mental Health Day. So we would like to know regarding this World Mental Health Day from Mr. Murnal perspective. How does UNICEF, especially UNICEF Indonesia, approach adolescents, especially for supporting them in health issue, focusing on mental health issue in Indonesia and Aceh?
Okay. So UNICEF has a multi-pronged approach. It's more of a holistic approach, focusing both on prevention as well as early identification and then referral for appropriate treatment. It works at multiple levels, at the level of the provider, the health facilities, at the level of communities, including youth communities. And it works also in this realm of creating awareness on this issue, right? And as part of our global agenda, we continue to support these thematic areas, and especially the World Mental Health Day activities and efforts. To talk a bit about specifics, we have ongoing programs in 3 provinces, in 3 districts of the East Java province, where the focus is on trying to decrease the prevalence of smoking, right, among adolescent populations. And this is again a multi-pronged approach, working with colleagues from the Department of Education, Health, and working with parents and forums, including youth forums, to try and give better messaging around why is smoking harmful, working on the policy issues and trying to curb on the minimizing of harmful advertisement practices. It's a big industry that government and organizations like UNICEF have to take on, and it's a resource match, right? There is millions on one side and there are little resources on the other side, right? And how can we make safe spaces for children where they are not exposed to smoking or the continuous barrage of advertisements around smoking. So there's some work that we are doing specifically in the East Java province. In Aceh, we have a couple of interesting things happening. So in around 47 high schools across 6 districts, we are trying to raise the conversations on mental health issues. And I was fortunate enough to visit one of those programs over the last couple of days. And there you can see how there is raising of awareness of mental health as an issue, which needs to be identified and dealt with in a sympathetic way, in a friendly way, amongst teachers, amongst the management of the school, and then creating peer support groups within the children themselves, the adolescent youth group, where friends can talk to each other and be supportive to each other. So there is a whole work which is again led by the government, which UNICEF has been fortunate enough to be part of this journey. There is also the work with the Youth for Health program that we do, started last year, and through that we are working with over 1,000 youth who in effect have impacted around 150,000 of their peers through online as well as interpersonal communication, and then trying to address again what challenges there are and just be there, supportive, awareness creation, just spreading the message, it's okay not to be okay, seek help, This is not the end of the world. You know, so I think there are all of these evolving programs, and with this stronger relationship that we have with the entire government of Aceh across several departments, we will be working more and more closely, identifying specific issues, because Aceh is unique. What is applicable to a Java like situation may not be applicable to Aceh, so you'll have to make some responses, and we will continue our collaboration on that.
Inshallah. Yeah, it's very interesting. I have privileges to come to the event like Year for Her Impact, and very interestingly, Mr. Martinez and Celia, I saw a junior high school student, if I'm not mistaken, second grader. They speak up regarding health issue fluently. It's like back in the day, I think it's not common back in the day for the junior high school can identify and speak up regarding their issue. But nowadays, we see that a lot of junior high school, senior high school, be able to identify and speak up. So this is very interesting, and the approach of UNICEF to make sure the social movement, especially from the adolescent, is very interesting. So the children not only look for as the participant, but also they do something for their own community. That's very nice. So the last question regarding the mental health issue, and also especially for adolescent, Mr. Martinez, how do you think the government, especially school, facilitates to fulfill the adolescent health in school?
It's like what the aim of healthy school movement. I believe that many actors must be involved in succeeding this program. Parent, teachers, schools, managements, also policymakers and communities. So at least we have pentahelix things. But condition that we have to create is a trust. So we trust that every actors can contribute to the mental health problems, to reduce mental health problem in schools. And how to create that is by communications. We are very open to any insight, any information to communication between parents and teachers, communication among the peers, among the students, that must be enhanced. I believe that by good communications will yield trust, and I think if we trust each other, and then the problems will be erased.
Okay, so even the government facilitates the student to speak more, to have much more deep interaction with their peer or with their teacher, to talk about not only the study materials but also the social and mental life, right?
Yes.
That's very nice. So we come to the end of our discussion. We would like to hear the closing statement. Maybe we can start from our adolescent health leaders, Celia.
Okay, so especially I'm trying to say these words to my peers, my adolescents peers, my friends, and also the youths in Banda Aceh and also in Indonesia, and especially globally. Well, I would like to say that to achieve Indonesia Generasi Emas 2045, we have to support the main goals of trying to overcome the real health issues regarding smoking problems, mental health issues, and also air pollutions. That is why I would like to say, I hope that all of my friends, because I would like to say thank you for the government and also the UNICEF for providing us with forums and communities where we youths and adolescents can actually participate regarding to speak up about these health issues we are currently facing. And that is why what I would like to say to my friends is that keep thinking smart, stay away from drugs, and keep your happy smile. Be happy.
Nice, thank you, Celia. And maybe for Mr.
This is not fair. How can I follow such a brilliant statement? Yeah. Now, I think I would just like to re-emphasize what our colleague said. and probably say that we need to work harder to create a more enabling environment, safer spaces, and ride on the digital bandwagon so that we flood the system with good information, with good messaging, and use technology to our benefit. And like you said, life goes on. It's a struggle. Be prepared. And remember, Thomas Edison, the great scientist who invented the bulb, you've only heard about the invention.
Yeah.
You have not heard about the 900 other things he failed to invent. And you have not heard about the 1,000 odd struggles or the prototypes he prepared for that final light bulb. Right? So, behind every success, there is a lot of failure. And I think just accept that and be yourself and be the best version of yourself.
MasyaAllah. Luar biasa. Thank you, Mr. Brunel, and also for Mr. Martinez.
Yeah,
Closing statement.
I'm very lucky. I feel very lucky today. I am very inspired by Celia, and convinced more that we have to involve more the young generations to solve their problems, and we have to trust them, and also we also appreciate the UNICEF that very seriously work hand in hand with government to solve the problems. And of course, we do hope that our cooperations, our communication will be strengthened much better after this, and to solve mental problems, to prepare our younger generation really prepare for their life, both when they face the success or where they gain the success or they face the failures.
Yes, thank you very much, Mr. Martinez. So, Rakan Murno, it's been a really meaningful discussion we have today. So, if I can conclude it in one sentence, we do believe that it's okay not to be okay. Ask for help. Therefore, young generation can lead Indonesia for the golden generation 2045. So, thank you very much for today's discussion. It's really pleasure to have such an inspiring young leaders, and also Mr. Brunel. Welcome to Aceh, and we hope you can come and visit us again and see what we already developed in Aceh in the future. And thank you, Mr. Martinez. We hope we can always work together to create, especially Gerakan Sekolah Sehat, to be implemented and fulfill the goals. Thank you very much. Pleasure to having you here.
Thank you.
And let's meet again in another session of Speak. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Thank you, Mr. Martinez.
Ya, makasih banyak ya, Bang.
Thank you, Pak.